Hi guys, this is Jason Williams DO. This is the Williams Family Medicine Channel, helping you to live your best life. Today I wanted to talk about having fun. In some of my other videos I've talked about the benefits of exercise and sleep and meditation and diet, other lifestyle factors that might influence how you feel and influence your immune system, influence your health. Today I wanted to focus on having fun. Today I brought a Rubik's Cube as an illustration, and I'm going to solve this Rubik's Cube while I'm talking to you a little bit about the topic. First of all, my brother and I became interested in the Rubik's Cube when I was in 6th grade. My brother was in 3rd grade, I think, at the time. So we thought, well, we don't know how to do this. Let's figure out how to solve it. It seemed like it was impossible. It seemed like something that most people couldn't do, but it seemed interesting to us. So we bought a book that had certain patterns. These patterns are things that you can recognize to determine what the next move is, what your next step is. It was very basic. The book was only maybe 10 pages long. It had some specific number and letter type of directions that you had to learn. And once you practiced, you could solve the Rubik's Cube. As you can see right now, I've already solved a couple of the layers just within a couple 30 seconds or so. You have to orient all the pieces in the right place, and it's tricky sometimes. You have to recognize certain patterns that you've already seen before, and if you see the pattern that you recognize, then you can make the right move and solve the cube. There are a lot of people that became very good at solving the Rubik's Cube. People, of course, have been in competitions. These competitions, speed cubing competitions, where they actually use very fancy cubes. This one is just an off-the-shelf stock cube. It doesn't have any fancy type of graphite on it. It's just a regular Rubik's Cube that you could buy at the store. But they have fancy ones that they use that spin easier, that don't get hung up, and they use graphite with it. Even with this though, you can see it's solved already. Even with this, and even not doing it for a lot of years, once you get used to it and practice, you can become good at it. It's fun, it's a fun activity. It improves your memory, it improves your visual spatial capabilities, and even your hand dexterity. I think there are a lot of things that we discount as trivial and not important and don't value them enough, and having fun is one of those. Just to go into more detail about that, there are many physiologic benefits of play or having fun. I'm going to talk about this in regards to some specific scenarios. These will be very obvious but may give you support for your fun activity. One is playing a musical instrument. Musical instruments help you improve memory, cognition, dexterity, and even breath holding. If you play a woodwind instrument, breath holding can help you to decrease your risk of sleep apnea, in fact. I have another video talking about sleep, and in that video I even talk about the Aborigines from Australia that play the didgeridoo. They tend to have less sleep apnea just because of the breath holding technique required. Playing a musical instrument has been shown to decrease stress and anxiety and other mood disorders, increase sense of well-being, and even increase the hormone oxytocin, which also increases sense of well-being and connectedness with others. Playing musical instruments has been shown to increase dopamine and decrease cortisol level, which are both beneficial for stress levels. Another fun activity you can try is singing. Most of us sing when other people aren't around or watching or listening. This is an activity that can be very beneficial for your health as well. You still have the breath holding aspect, which can be good for sleep apnea type conditions. Singing is often done in community, and this helps you to enjoy community, a sense of connectedness. We've talked about community in other videos about the importance of this on your mental health. Studies have shown that people that are in a faith-based community, for example, often live 7 years longer than those who do not participate in such a community. Singing has been shown to decrease pain. Of course, singing can decrease stress and grief. Singing has also been applied to those who have speaking disorders, such as people that have had a stroke and have aphasia, people that have autism, people that have Parkinson's disease. Singing tends to allow them to communicate easier. Next, listening to music. Listening to music is a little bit more passive than singing and playing an instrument, but still has been shown to have benefits on endorphin levels and immune function. Another aspect of listening to music is the effect of vibration. There's a treatment called vibroacoustic therapy, which has been helpful for people that have Parkinson's disease, Alzheimer's, even fibromyalgia. I've heard of vibration therapy to be also useful for people that have restless leg syndrome. Studies have shown that people that listen to music have increased immunoglobulin A and increased activity of natural killer cells, which improves your immune function and your ability to fight infection and disease. Next, laughter, another way to have fun. Humor and laughter have been used throughout the ages to help with stress, relieve tension, and improve functionality, especially in a grief situation or a high stress situation. They've studied laughter with regards to the educational process and have noted that students tend to have less tension, concentrate better, and tend to learn better in an environment where humor is injected into the teaching. There was a biochemistry researcher by the name of Norman Cousins back in the 60s and 70s who had ankylosing spondylitis and had severe pain. He took it upon himself to implement using humor and laughter to help treat his pain. He credits that to allowing him to thrive and live for another 25 years, even though he did suffer with severe pain. A lot of people will be familiar with the physician Patch Adams. Patch Adams was also a big proponent of using humor in order to help make the environment for patients more suitable and less threatening. His efforts were instrumental in bringing clowns into the hospital system. Social interaction with friends is another one. This one is great. You have the community aspect for sure. You also have improved memory just because of your needs to remember things in conversation. Actual studies have shown a decreased C-reactive protein levels and decreased blood pressure levels in people that are commonly interacting socially. This means decreased inflammation and likely decreased overall risk for cardiovascular events. Reading is another one. I have some of my patients that are proud of the fact that they read a lot and are trying to decrease cognitive decline with their efforts. Reading, of course, promotes memory and expansion of vocabulary, but also helps you to interact socially with the world around you better. Any type of learning and reading results in a dopamine release, which enhances your sense of well-being. Next, a big one, solving word or math puzzles. A lot of people have apps on their phones, or they have a book that they carry around with them in airports or in lobbies of busy doctor's offices where they can solve word puzzles or math puzzles. These things shouldn't be viewed as trivial. They actually can improve your memory, decrease your risk of cognitive decline, and also they still affect the dopamine reward center of your brain. Additional benefits, of course, visual, spatial, logic, just using parts of your brain. If you don't use your brain, you lose some of that function. Next, playing board games or card games. Of course, this strengthens the community bonds, which, as we talked about earlier, are very important. Also, oftentimes laughter is incorporated in board games, so you get the benefits of laughter with the hormone releases. In children in particular, it's a great swap. Children often have excessive screen time, and this is a way to get them into a more active environment away from screen time, and also to have healthy social interactions, training for life later on. Of course, board games and card games can improve memory, logic, problem solving, and reasoning skills. Completing jigsaw puzzles. Jigsaw puzzles are great for visual spatial training. You have to orient pieces in your mind, flip them around in your mind, try to make them fit. You have to recognize colors and shapes. It helps with memory and also helps to decrease cognitive decline. Another aspect of having fun that is really good for you is playing a sport. There are many different types of sports, some that are very complex, some that are very explosive. All of them require motor control, neurologic control, and thought control. Some of them require emotion control, such as golf, for example, when you hit a bad shot. Many sports that are very physical result in increased endocannabinoid release and increased endorphin release. Dopamine is commonly elevated in people that are active in sports and exercise. In former videos that I talk about exercise, I discuss the fact that longevity can be increased by even 400% in people that actively exercise regularly. Of course, sports are a great outlet for stress. You would have to watch out for overtraining. Some people overdo it and they can get injured and broken down if you do too much. But sports and exercise in general are a great thing for most people. Even people that are older in age, you just have to adapt what you do. And lastly, just learning in general. Spending time learning new things, exploring new things, using your mind, being creative. This decreases risk of cognitive decline, helps improve sense of well-being, helps give you purpose, helps you interact socially with others better. There are many other ways to have fun. These are just some of them. I want you to know that there are physiologic reasons that having fun helps you and helps you be healthier. The next time you feel bad about playing a game on your phone or doing a word puzzle, think back about this video and realize that you're actually doing something good for your health. You're not just killing time. If you are my patient, I hope you found this information useful. If you are not my patient, you need to see your own doctor for diagnosis and treatment. This is Jason Williams, DO. This is the Williams Family Medicine Channel, helping you to live your best life.